Hello, everybody. Thank you so much for being here today. I am just trying to navigate my screen here.
Yes, to go forward, you keyboard arrow or back.
Sure. Okay. So I can't see like any kind of chat box or anything like that. Is that okay?
I can run those.
Okay. Okay. It doesn't matter to me, just as long as, yeah, everything is good on your end.
All right. Well, let me go ahead and introduce you. Welcome, everybody. My name's Warren Boykin. I'm the Program and Outreach Coordinator for NAMI Northern Illinois, and this is leading the conversation. This is a webinar that we host um, usually every Thursday, but it might be we might miss a couple, but we certainly try to have interesting presentations for you, like this one. Our guest today is Kate Deckard-Gonzalez. She's an LCPC, licensed clinical professional counselor,
Hmm.
uh, with experience in several clinical environments, including child welfare, community mental health, and higher education. She now works in private practice at Willow Creek Counseling in Rockford, Illinois. A little bit about her background. After becoming a mother in 2021, Kate grew passionate about normalizing the struggle and reducing the stigma of asking for help during the transition to parenthood. She obtained a certification in the treatment of perinatal mental health disorders, including depression, anxiety, panic disorder, bipolar disorder, psychosis, and PTSD. Kate's work spans the entire perinatal period, including pregnancy, birth, and postpartum period. Kate also provides psychoeducation and support to women and families struggling with fertility challenges, birth trauma, and perinatal loss. In addition to utilizing modalities such as CBT and IPT, Kate is trained in accelerated resolution therapy, also abbreviated ART, which utilizes the power of eye movements to erase and replace negative images and sensations stored in the brain and body. So, without further ado, just a quick note, we generally disable the chat during our webinars, but there is a Q&A box that I'll be monitoring, and normally we hold the questions until the end. I'll read them for you, Kate. And if there's anything I forgot to mention, I'll just put the question that's into the chat box. I mean, excuse me, the Q&A, and I will bring it up to Kate at the end. All right. Like I said, without further ado, I'd like to hand this over to Kate
Thank you.
Deckard-Gonzalez.
Thank you. Um, and thank you everyone for being here. This is a topic which is really near and dear to my heart. So it's odd to hear someone, tell your story or all the info, but that was a very good overview of some of what I was just going to say too. I'm an LCPC in Rockford, so I'm a licensed clinical professional counselor, and have been working as such for oh gosh, like about 10 years. And I've been working pretty much exclusively with the perinatal population since 2022. Um, as was mentioned, since I had my daughter in 2021, that really kind of changed the trajectory for me. So I'm passionate about perinatal mental health, and I'm grateful for any opportunity to speak on it. So I'm going to show you guys our agenda today. So, the first thing we're going to do is talk about what are perinatal mental health disorders. And I did a similar presentation last year, specifically about postpartum mental health. And so, this time I'd like to have more of a broad spectrum conversation about the entire perinatal period. And more so than that, not just about, the nuts and bolts and specifics of each disorder, but why the conversation's important and what really prevents people from speaking up and getting help during this time. So we'll talk about what causes the disorders to happen, Again, the specifics of, the characteristics of depression versus anxiety versus OCD, things like that. What are some barriers to treatment? And then whether you're a clinician or a family member or a friend or an advocate for perinatal mental health, some treatment options and some tools and it's just messages and things that you can give to people that start to open up conversation and validate the experience. So I will have
Okay.
a list of, yeah.
I remembered what it was that I was supposed
Oh,
to
yeah.
mention. CEUs are available for this presentation. And what will happen is that if we will send out a copy of the slides to the people who attend the session, and there will be an evaluation. The CEUs are provided by Rosecrance, and they will send a evaluation to those who need CEUs. So just reply to the email that we send with the slides and say that you'd like to have CEUs and stay with us through the presentation, and we will take care of that afterwards.
Perfect.
Okay, thank you.
Yeah. So I'll have a list of resources at the end, and then I'm hoping that there's time for questions, and that you guys can use the Q&A feature to send anything that you're thinking or any questions that you have. So the first thing, what are perinatal mental health disorders? So the acronym that we typically use is PMHDs. It was previously called PMADS. So if you ever read that or hear someone say PMADS, it used to stand for perinatal mood and anxiety disorders. They didn't love the acronym, so they changed it, but same thing. It's a group of illnesses that impacts at least 1 in 5 women during pregnancy and the postpartum period. So PMHDs cause emotional and physical problems that make it difficult for women to care for themselves, care for their families or their babies. And some typical types include depression, anxiety, OCD, PTSD, and psychosis. So some other noteworthy terms here that I just want to cover quickly to make sure we're all on the same page. Perinatal refers to the time frame between conception and through the first year after birth, whereas postpartum is typically just known as the first year after birth. There's a lot of arguments that it should actually be stretched out further. And then, on the flip side of that, I have people that come in my office all the time and say, I'm experiencing this or that symptom, but I know it can't be postpartum because I had my baby 7 months ago. So it's just a kind of a general guideline that first year after birth, just to let people know that your body and your mind and your emotions are going through big changes. So whether it's a year or 2 years, I think it just helps people to know that it's a turbulent time. PSI. PSI is Postpartum Support International. They are the largest organization that deals with training and prevention and awareness and fundraising for all things related to childbearing. They are also the organization that is responsible for my training and certification. So sometimes people ask me questions about, like how do you become a PMHC or, what kind of training is involved? And I'm always happy to answer questions about that because our community needs more perinatal therapists. But there's also kind of a step-by-step guide on the Postpartum Support International website. It's a great set of information about just all the different disorders that can happen during the perinatal period and all of the free resources that they offer. So great resource if anyone is working with clients or has loved ones that are, within this perinatal range. So this next slide, I'm going to introduce a video that is actually, I think it's probably more of like a specific ad for this program, which is called the Motherhood Center in New York. But I like it because I think it does a really good job of introducing just some normal, common things that people will say during the perinatal period, some common symptoms and thoughts that people have, as well as some of the barriers to treatment, the societal expectations that surround being a mother, and what prevents people from getting help.
Kate,
So, yeah.
There is one thing I think if there's sound in your video, we may have to change the settings on your share. Um,
I clicked the box. Was I supposed to do that?
Perfect.
Oh,
So
good.
you
Okay.
did. Okay, great.
Okay, so we should be good. But we'll go ahead and watch the video. And the Motherhood Center is a pretty unique setup, actually. They really want to get away from more of a medical model and institutionalized care, and want people to feel almost like a woman in the video says that it's like a womb. They want to just wrap people in all of these supports and validate feelings and that transition to motherhood. So um, I think it does a really good job of just explaining some of those things. So we'll go ahead and watch that now.
I gave birth to this little tiny person who I loved instantly, but I did not fall in love with.
There was this immense pressure of, what if something happens to her? What if something goes wrong?
I had a double whammy. I had a new baby, and then I had, oh, my baby's Down syndrome is going to be a special needs child.
All of a sudden, I was alone with a baby, and I lost it.
I was losing a lot of weight. I wasn't eating. I was hardly sleeping.
I experienced pretty severe postpartum anxiety.
A wickedly bad case of postpartum insomnia. I had a 4-day-long panic attack.
The worst time of my life. Inability to bond with my child, sadness, anger, suicidal tendencies.
I hadn't left the apartment in probably 8 or 9 weeks.
The last few nights were just panic attacks throughout the whole night.
I didn't think it would happen to me.
I just didn't think it was possible that that could happen to me.
I don't think anyone thinks it's going to happen to them.
I was in a state where I needed some serious intervention right now. And so the Motherhood Center was like, they were an emergency.
Generally speaking, the women we treat here at the Motherhood Center are women who are high-functioning, well-adjusted, who then go through this period of extreme distress. They're overwhelmed and they need help.
It's like night and day. I mean, you walk in here and this place is like it's like a womb. It's so warm, it's so kind.
It's that radical acceptance, right?
I was just talking about that with somebody.
They understood right away that what I needed was not psychiatric help in a hospital, but I needed a warm, loving, motherly environment.
They said, you know, there's going to be group therapy and individual therapy, and there will be arts, and we'll have yoga, and then there's a sleep expert for the babies. And so all this was like, is this for real?
I think being with other people, being in a circle with other people going through something very similar was as nourishing and nurturing as the skills that we did.
I'm mad, like I'm effing angry, like why me?
You are in a group with women that are discussing this thing that we have that bonds us, that knows no race, religion, creed, socioeconomic status. It doesn't care.
And they made me understand that that it wasn't me. I wasn't crazy. I wasn't a bad mom.
It is what it is. Nothing to be ashamed of. The ethos here is very much about treating the whole person, the whole woman. We bring her into our community, our center, and we work with all those parts to help someone feel whole again so that they can go out and function beautifully in the world.
I'd never received this level of care in my life.
The reality is you leave a better mother and you're able to give your kids more.
I knew I needed to be here, but in my mind, I'm like, I'm not a person who is here. I'm not a person who falls apart. That wasn't my image of myself. And it is so liberating to be like, hell yeah, I came here. And it was one of the most important and meaningful things I've ever done for myself, and I am so grateful.
I left here feeling better. I left here a changed person. I left here more mature. I left here a better mother. And I left here with skills that I use every day in my life now.
Okay. Great video. Tells a lot of information. Oop, there we go. Okay, so why are perinatal mental health disorders important? So one of the things that I have implemented in Rockford in the last few years here is, as I mentioned, Postpartum Support International has the largest network of resources, I would say. They're a worldwide organization, and their worldwide event that they do is called the Climb. So it's aimed at awareness and prevention and fundraising for perinatal mental health. So it's held all over the world, but we've had it in Rockford here. This will be our third year. It happens in the fall. And as I'm planning for that, I spend a lot of time trying to convince people that this is important. And a lot of times when I start talking about perinatal mental health, people look at me with like this blank look. And I can't even really fault them for that, because before it happened to me, I didn't know a ton about it either. But I'm going to tell you why it's important, like I tell them why it's important. So 1 in 5 women, 1 in 10 men experience a perinatal mental health disorder. So we expect that this number is probably pretty modest too, because of shame and stigma that go into reporting perinatal disorders. It's probably higher than this, but we would say about 20%. We know that rates were definitely higher during the pandemic for obvious reasons, whether that was, being scared of COVID and illness for your very vulnerable newborn, a lot of isolation, not a lot of help from family and friends, or a lot of people coming over to the house and things. But we know it's a very, very large number. We also know that it's the #1 complication of childbirth. So if you've been pregnant, or if you have been involved heavily with someone who's been pregnant, you know that there's a ton of visits in the prenatal period. And during that time, doctors are doing a lot of education about physical health conditions, and rightly so. But I remember going to my doctor's visits and, always having your blood pressure checked and talking about the warning signs for preeclampsia. And do you have blurry vision? Do you have headaches? There's a big workup and that great drink for gestational diabetes, screening for that. Lots of growth scans where they're measuring your amniotic fluid levels. So tons of things related to physical health. But if we look at the numbers around this, we know that about 2 to 10% of people will have gestational diabetes. We know that about 3 to 8% will have preeclampsia. We know that people who will have low amniotic fluid in pregnancy are about 4%. So then you look at this in comparison to 20% of people who will suffer from a perinatal mood or anxiety disorder. It's a huge difference. And if you think about that time frame too, the perinatal period is all the way from conception through that first year after birth, roughly. So we're looking at about a 2-year time frame when any of these things can pop up. So it makes sense. We have to be screening often, and really talking about this with our clients and our patients. We know that perinatal mental health disorders have a ripple effect across the entire family unit. So, if this is your first child, these are, your first moments of building that family unit. And it feels sort of like the foundation of your family. And if those first moments are dark or scary or confusing, it really sticks with people, and it can have a really long-lasting impact on bonding, on attachment. We know that untreated PMADs can result in developmental delays. It can result in poor parent-child attachment. And, even just beyond the parent-child attachment, if you bring a baby into your home or another child into your home, it's huge for a relationship too. So if you're in a partnership and suddenly you're having to communicate about who's getting up with the baby, how are we going to make time for our individual hobbies and interests? How are we going to make time for each other? If somebody's staying home and you're going down to one income, financial stuff can come up. So when you're already in a vulnerable position and you're adjusting to all these other changes, it just ripples across the entire family unit. A word about bonding too and attachment. I feel like I hear a lot of my clients saying that they start to personalize things too. You know, when you're feeling in this place where you're really sad or unmotivated, or your self-esteem is really impacted, we start to do this thing called personalization, where we look at our baby and we interpret whatever probably normal behaviors, crying or, fussiness or whatever, as something about us. So a lot of my clients will say, my baby cries all the time because they can tell I'm not cut out for this. I'm not a good mother. They would be better off with somebody else. Or they'll start to say things like, I know my child doesn't like me. They know that I'm not a good mom. So we have to, start to look at those things and the impact on bonding. And we'll talk more about that in the treatment section too, but start to challenge some of those thoughts. We know that 80% of cases go undiagnosed and untreated due to lack of awareness or the stigma surrounding maternal mental health and the scarcity of specialized resources. So, as was mentioned in the bio, like a lot of us, my passion for the topic is born out of my own experience. So, when I had my daughter in 2021, you think being a therapist, you're probably going to have a better understanding or a better idea of where to look for resources. And when I went to get help for myself in 2021, there was not a perinatal therapist within 50 miles of Rockford. So, even having a vague understanding of what was happening to me, when you're desperate for help and you're ready to receive help and you're told like, there's no help, there's nobody in the area, it's so discouraging. So we need more. Also noteworthy, approximately 50% of PMHDs develop during pregnancy. So if people know anything about perinatal mental health, people usually know the term postpartum depression, and kind of like lump all the perinatal disorders under postpartum depression. But actually, 50% of cases can be traced back to pregnancy. And that's important because if we can detect early, then we can certainly start to normalize and validate people's experience and make postpartum mental health plans. So again, screening, very, very important. And then normalizing and having these conversations with your family, your friends, your provider, so important. And the most important point here, these illnesses are so treatable. So a lot of people will say to me, like, is this an indication of the kind of mother that I'm going to be? No. And, I'm always telling people, they have to talk about it and be vulnerable and blah, blah, blah. So I'll do that with you guys right now. Yesterday, I was at my parents' house and my daughter's walking through the kitchen in her Rapunzel dress. And I looked at my mom and I said to her, gosh, I just love her. And she looked at me and she's like, do you remember when you thought you never would? And I do. I do really remember that. I thought, I would never be attached to her. I'd never bond to her. I'd never love her, because that first 10 months was so dark. And so I always tell my clients too, you will heal from this with treatment. You will be well. And it's not an indication of what your entire journey as a parent is going to be. So these illnesses are treatable and people recover. So what causes it to happen? Well, a lot of people blame the hormones, and I mean, that's part of it for sure. But we know that can't be the only reason that PMHDs happen, because we see them in dads, in non-birthing parents, in adoptive families. So it plays a large role, but it can't be the only factor. So we would say that PMHDs are a biopsychosocial experience, kind of shown by this Venn diagram down here, all these overlapping things that are at play. So if we go back to the hormones for a second, this biological and hormonal component, We do know that people who have a sensitivity or have had a sensitivity to hormonal changes in the past, so such as, maybe they have PMDD, or they really struggle with mood changes around their cycle, or they struggled a lot during puberty. Anyone who's had a sensitivity to hormonal changes before is at higher risk for a perinatal disorder, or those who have like an endocrine dysfunction or polycystic ovarian syndrome. Those kinds of things definitely make someone more likely to have difficulty in the perinatal period. We also know that any person who has an existing mental health issue of any kind, so existing depression, anxiety, bipolar disorder, or a family history, also more likely to experience PMHDs. Now, when we look at the social and environmental things here, there's a lot of factors at play. Certainly circumstances related to your environment, like financial struggles, marital stress, any kind of complications, that like a move, a death in your family, health issue, COVID, stuff like that, all contribute. But then we also know specifics related to the baby can also be a factor. Birth of multiples, definitely stressful. Also, if you've had a traumatic birth, a NICU stay, any issues with, breastfeeding or, sleep, things like that, temperament of your baby, all of those things go into it as well. And then, a major question that people will ask me too is like, well, I had really severe postpartum depression or anxiety or whatever with my first baby. Does this mean that it's going to happen to me again? And the answer is technically you are more likely. If you've experienced a postpartum illness or a perinatal illness with one child, you are more likely with subsequent pregnancies. However, the reason that I really like to tease out, what was it play the first time? So if I have somebody that comes in and they're like, they had no information or education about perinatal mental health, that contributes. If, they tell me like, oh, my father died shortly before I got pregnant and I was grieving, or we moved out of state, or my first baby was during the pandemic, or, you start to look at all of the factors that could have contributed and try to offset those. So one of my most favorite things to do with people is, like I get somebody maybe after their first baby who's struggling with a postpartum illness. And then we work through that, or a traumatic birth or whatever. And then they tell me, I think I want to have another baby. And so we start to plan for that. I get to be with them all through the next pregnancy and birth and everything, and watching it go better for them because they've been treated, because they've been educated, because their feelings have been validated. It's one of the most rewarding things to see somebody navigate that. So I like to say that, yes, you are probably more likely, but there's a lot that we can do to try to offset things too. Okay, so next what we're going to do is we're going to go through some of the specific disorders that people can experience during the perinatal period. So what I want to say too about this is, if you're familiar with the disorders themselves, like depression and PTSD and OCD and things like that, they're not terribly different in terms of the symptoms during the perinatal period. The major distinguishing factor here would be the time frame in which they present. So, perinatal would be any time between conception and the first year after birth. But clinicians will ask me a lot, how do you code for this in terms of insurance and things? So the DSM-5, our Bible of disorders and things, actually does not have any perinatal disorders specifically listed. The only thing that's in there for the perinatal period would be if it's peripartum onset, which would mean the first 4 weeks after birth. So basically, If you don't have presentation in the first 4 weeks after birth, there's nothing specific for a perinatal disorder in the DSM-5. So the way that I will typically code for this would be coding it as an adjustment disorder, because that's, what it is. There's a major life transition and you're having a response to it. So that's kind of what that looks like. If you have questions about that, though, for clinicians, let me know. So depression. So some of the typical characteristics that we would see in any person with depression: sadness most of the day, nearly every day, a lot of anger, irritability, rage. Sometimes there's, overeating, undereating, wanting to sleep all day, not wanting to sleep at all, crying spells, little interest in things you used to enjoy, and possible thoughts of hurting yourself or the baby. So people ask me too, well, what's this about the baby blues? And how do I know if it's the baby blues or if it's postpartum depression? The baby blues is typically just around the first 2 weeks after birth. So it's concentrated to that time period. It is experienced by about 80% of people. Mostly they think related to the hormonal changes. So that big drop off in hormones that you get right after delivery. But baby blues, I would say, are more mild and transient symptoms. So you might have some crying, you might have sadness or some mood swings or things like that. But typically it's within the first 2 weeks and it's not so distressing and disturbing. Where we start to cross over that line into postpartum depression is when people are having more of, the thoughts of harming themselves, and their self-esteem becomes very impacted. And by that, I mean, they're having a lot of thoughts like, I'm not cut out for this. This was a mistake. My baby would be better off without me. I'm a terrible parent. I'm never going to get through this. Things like that seem bigger and very much about themselves. So your self-esteem definitely is impacted. Looking at anxiety, we're looking at a lot of worry, a lot of feeling like something bad could happen to you or baby, racing thoughts, sleep disturbance, some restlessness, and then physical symptoms as well that you might experience with anxiety, hot flashes, nausea, dizziness, headaches, all that kind of thing too. Now, where I start to see things drift a little bit is with somebody who has maybe had anxiety before they've had a child, and then it turns into OCD in the perinatal period for a couple of different reasons, I would think. So with OCD, we have the obsessive intrusive thoughts. They could be images, they could be thoughts themselves. They're typically related to the baby. So I would say OCD, although the symptom presentation is the same with, the hallmark of obsessions and compulsions, this one seems to be very specific to baby. So a lot of times it's related to, is baby breathing? Is baby going to get sick? With images, a lot of times people have pretty distressing images of, throwing their baby out the window or falling down the stairs or things like that. So these images and thoughts are not wanted, they're intrusive, and they're distressing to the person. And that's a really key characteristic here. So people feel so much shame that they have these thoughts, that they have these images, so much so that they don't want to be alone with their baby. They're afraid that they're going to act on them. But what I tell people is, if you're distressed by what you're thinking and feeling, that is a great sign, because it means you don't want to hurt your baby. If you can hold space for somebody just to talk about that without judgment and validate for them that it's a thought, it's not a fact, that's so huge for people, because, there's a lot of fear in speaking up, because if people think, oh my gosh, if I tell somebody I'm having these thoughts of throwing my baby down the stairs, they're probably going to deem that I'm an unfit mother and take my baby from me. So there's a lot of nuance in treating perinatal disorders, and a lot of space that you just have to hold for people to talk through things and validate the experience. As I was saying, though, a lot of times I see people who have had existing anxiety kind of morph into some OCD territory. And I think a lot of that becomes easy because of all of these like gadgets and things that we have now for babies. A really common one is I have a lot of moms who cannot sleep because they compulsively check the baby monitor, because we have that nice video feature now that you can actually be looking at your baby all the time. I have a lot of people who sleep next to the crib, and some of those things are okay, but not if it's because you just cannot stop thinking, is my baby breathing, you know? So I think that there's a lot of people that kind of, because of the added caregiving responsibilities and things, that start to trickle into this OCD category. Next, we have PTSD. In my experience, this most often comes with birth traumas or traumatic losses. So a person who's having a re-experiencing of any kind of traumatic event, flashbacks and nightmares, they're having some physical increased hypervigilance, irritability, startle responses is way up there, anxiety and panic. And those that have perinatal PTSD often report themes of feeling like they didn't have a lot of decision making in whatever happened with the trauma. So with birth trauma specifically, if a person feels like they weren't involved in the process of whatever that birth scenario was, whether it was like they had to have an emergency C-section or things like that, they often feel like they didn't have they were invisible in the decision making process, or they didn't have all the information to make an informed decision. Some of the most common things that I will see as the result of a person having PTSD would be, like I mentioned, an emergency C-section, or if there was any type of injury at birth to baby or to mom. Some other things would be like if you had to have use of a medical intervention like a vacuum or forceps or things like that at the time of birth, or if your baby was immediately removed and taken to the NICU. All of those things can certainly go into a person deeming that their birth experience was traumatic. We also say that trauma is in the eye of the beholder. So there's a lot of things that can impact a person's perception, obviously. So you could have two people with very similar births. One thinks that it was, no big deal, pretty average birth experience, and another person thinks that it is traumatic. So all of those biopsychosocial factors that we just talked about on a previous slide definitely can impact a person's perception of their birth experience. And then the last specific disorder that I wanted to talk about is psychosis. Now, this is considered a medical emergency. So if you're having delusions or strange beliefs that feel very real, seeing or hearing things that are not there, feeling very irritated, severe depression or flat affect. Another key sign here is decreased need or inability to sleep, big mood swings, difficulty communicating. This is a rare disorder, but it's important to talk about. It happens in about 1 to 2 out of every 1,000 live births. So even though it's rare, it's an emergency. So I like to keep people aware of the National Maternal Mental Health Hotline. They are a great resource. It's available all the time, 24/7. They will link you to your local resources, or you can even call and text them. So it's a great resource to give to people too. So why do people not get help? Well, I think that we all know that there's still stigma surrounding mental illness, but I would argue that there is an even higher stigma around maternal mental illness. And I think that that goes really far back to what we expect from moms, what we like how we view the mother figure and how we view motherhood. Um, I feel like a lot of times mothers are painted to be this selfless, giving being that's kind of like the glue of the family. And, the mom can, cook all your meals and keeps up with the house and takes the kids to all their activities. And it seems like, she's never tired. She never complains. She's never burnt out. And, I think when that's portrayed to people and you have a different experience, it leaves people with feeling, why am I having such a hard time? What's wrong with me that I'm not loving this? Um, I always thought that motherhood was going to be this experience that was like the most fulfilling thing that ever happened to me, and I was going to love every single second of it. And I remember talking to my own mom about that, and she kind of laughed at me, and probably rightly so. But she said to me, this is hard work. It's not like every single minute is enjoyable, and if you're faulting yourself for not enjoying the experience of getting up in the middle of the night to change a diaper, then I mean that's not really realistic. So I was lucky that I had that. But when you're thinking that every single minute or every single second is going to be beautiful, it's not really like that. And our expectations and our societal pressures are pretty severe because of things like social media too. For millennial parents, you have these people who are documenting every second of their motherhood journey, and it can be really hard not to compare. My clients will probably hear me say a million times that comparison is the thief of joy, and it's hard not to, though, especially when it's in your face. Another thing that I talk about a lot with people is your expectations versus your reality, and that space in between what you expected and what you got is often grief. So whether that's, you didn't get the birth you wanted, or you envisioned, like I tell my clients too, I envisioned taking my baby home, and it was right around Christmas time, and like holding her around the Christmas tree and it being like the most beautiful, magical thing I ever did in my life. And it wasn't exactly that. So, there's grief in the sense that I wanted this experience, and I expected this magical, fulfilling thing that didn't exactly happen. So, a lot of perinatal work is holding space for people to talk about that grief. As I mentioned before, there is a fear that if you tell somebody how you really feel, then they'll take your baby from you. And so we need to train people to respond with nuance and not alarm. So being able to let a person talk about an intrusive thought that they're having, or the fact that people will say sometimes, like, I feel like I made a huge mistake. There's so much shame that they have in that, and saying, what if I did the wrong thing? What if I was never supposed to be a mom? And just holding space for them to be able to talk through that and talk about how it wasn't what they expected it to be. Another thing too is that our friends and family don't always ask how we're doing. I think that that's easier once you've had a child, but I know I've said to my friends who had babies before me, like, so sorry I didn't ask you, or that I didn't know. You can't fault yourself for not knowing what you don't know. But my hope is that if you do have people in your life who are having babies, that you ask the parents how they are too. It's so focused on baby, and like, people bring gifts for the baby, and that's all great, but just don't forget the parents too. And the doctor, is another thing. We don't always have a lot of follow-up with our doctor after we have a baby. I think most people typically have like a 6-week checkup, but then after that, not much contact with your OB. The person you probably have the most contact with is your child's pediatrician. And that gets pretty tricky too, because If your pediatrician is screening you, so let's say that they give you a screening tool. The most common one, the gold standard, is the Edinburgh, the EDPS. That's what's most often used during screening for depression or anxiety or things like that during the prenatal period, your prenatal visits. So if your doctor, your pediatrician, is giving you an Edinburgh and you screen positive for it, so indicating that you have a perinatal disorder, the doctor often thinks, well, what do I do now? You know, mom is not technically my patient, baby is. So on top of that, where am I going to send this person if we don't have a ton of resources? If I'm not informed about, you know, where to send somebody, whether that's virtually or in our community, it leaves people kind of guessing, what now? What do I do with this person now? So people don't always screen. And again, lack of specialized resources. So this is a huge need in our community, but not just here, but in our nation. Although the perinatal specialists, I guess, are growing, it's still something that's very limited. So with that, I think it falls on us a lot to ask, to open the conversation, to validate and normalize the experience of transitioning into parenthood being a difficult process. So if you're a family member or a friend, obviously, just asking the parents how they're doing, you know, acknowledging that it's a complicated time for your body and your emotions. You can also use yourself if you feel comfortable doing so. I can't tell you how many people in my life who I never knew struggled before came forward and said, I really had a hard time, or I struggled, after I had said, you know, that I had a really difficult experience. So you might be surprised by what people will tell you. For mental health providers, just again, normalizing that becoming a parent is very hard. I like to give a few feeler words for people, is what I would call it. So if I use words like overwhelming, exhausting, and even regretful, my clients aren't going to latch on to all of those things, but sometimes me using a specific word gives the client permission to say, oh my gosh, yeah, I do regret that I made this decision to be a parent, and then allowing space to talk through that. So just asking the person what the experience has been like for them. Medical providers, normalizing the experience by saying, you know, how common perinatal disorders are, and giving resources for people to get help. So all of our OBs at Mercy and at Swedes or UW Health now have a brochure that they can give to their patients. One half of it is my face. The other half of it, which I tell people is the more interesting part of it, is all of the resources for Postpartum Support International. So it gives information about their virtual support groups. It gives statistics to normalize things. It talks about where they can connect with a peer mentor through PSI. So even if that person never reaches out to me and wants to go face to face and talk to somebody in person, at least they have access to information to normalize their experience. And also if they want to connect virtually with somebody. So that's a big step for our community, to actually have somebody that's handing them something like that. Treatment options would be, you know, practical help and things. We'd say that the most life-changing thing for a postpartum parent would be 5 hours of uninterrupted sleep. We also are looking at things like practical help, like having somebody come over and care for your baby, or taking a break from the baby, having somebody set up a meal train for you, validating the experience, normalizing how hard things are. When I have somebody with me in counseling, we're talking about mostly challenging those irrational thoughts. And some of them are about us, some of them are about baby, but starting to look at the ways that our thinking is probably distorted. And that may be related to our expectations of what parenthood was going to be like. We're also looking at the ways in which our life has changed drastically, what roles we filled before we had a baby versus now. Because when you have a new baby, it feels almost like you are solely a mother, like the rest of your life kind of stops for a little bit. And so we want to find ways to balance caregiving responsibilities. We want to find ways to make people feel like they're still human, they're still themselves. And so therapy can be really helpful for that, to help people start to integrate some of their old life back into things. We do refer for medication when needed. Like I mentioned before, and you'll see on the next slide, we have the Dahlia Center here in Rockford. So they are specific to reproductive psychiatry, whether that is, PMDD stuff, or, issues during puberty or the perinatal period or menopause. They are specific to women's issues. So we can refer there. Sometimes the OBs are willing to prescribe, especially if they've been seeing you through pregnancy and delivered, or are with you through postpartum. We do have 5 inpatient facilities in the U.S., which is one more than last year. Actually, Louisiana was added this year, but these are specific for perinatal mental health. And then we also have outpatient programs, intensive outpatient, so like a day treatment program. The closest one to us, the only one in Illinois, is in Hoffman Estates. So that can be a good option for a client who's needing more intensive services than what I can provide just outpatient. Okay, so we have the Dahlia Center, like I said, that specializes in women's issues and perinatal psychiatry. We have 2 local PMHCs. One is me, and one is Stephanie Lynch. She works out of Alternative Wellness Therapies, which I believe is in Loves Park. And both of us are great options. Some nuances there too. Stephanie is a great source of information because she is a doula and a lactation consultant. So she's awesome with those things. The caveat there is that she does not take Medicaid insurance. So if you have a family member, friend, client, whoever with Medicaid, that's specifically probably me. We have the Postpartum Support International PSI helpline, which is available in English and Spanish. So you can call them. They will connect you with local resources or tell you based on your circumstances what they think would be a good fit for their programming for you. They have chat with a mom, chat with a dad. They have a peer mentor that they can assign to you. They offer a postpartum planning class. Tons of good stuff. This book that I've put on here, What No One Tells You, I always tell my clients that if I could just like give a copy to every person that I encounter, I would. But it's an awesome book. It's so honest. It's so truthful about the stuff that nobody's talking about. So there's a ton of really great things in there, all the way from, how to tell people that you're pregnant to, the first trimester, all the way through pregnancy, how to navigate your relationship after having a baby, returning to work, breastfeeding. It's a great resource. So I always recommend that one as well. I'm aware of time here too, so I'm trying to move quickly so that there's time for questions. One last thing though, Winnebago County now has a new program that's important for you all to know about as well. It's in conjunction with the health department and with Alignment Rockford. So this program is called Winning Start Winnebago. It offers a universal newborn support system. So any baby born in Winnebago County, regardless of their insurance or anything like that, they have access to this program. So you can access it during pregnancy, and they'll help you with pregnancy planning, making sure you have access to care, connecting you with a doula if you want one. And then after baby is born, they will send a visiting nurse to your home. So they'll welcome your baby, weigh your baby, ask you, how are you doing? Do you need mental health care? Are you struggling with breastfeeding? Do you need to see a lactation consultant? Do you have issues with providing diapers or food or things like that? And they connect you with all the resources that you need. So There's a QR code on here too that you can scan, or I know they said the presentation will be available, but it's a self-referral program, or like I refer a lot of my clients. They're going to start recruiting at bedside. So right after baby is born, they'll come in and give you the information. But brand new program, really great to know about though. And just wanted you guys to have the information for that. Okay, questions?
Okay, well, I really appreciate your presentation. Thank you so much, Kate. I'm going to see if I can share the questions on my screen so that you can read them. I know that
Sure.
okay, the first one, uh, it says, this is from Kaylee. It says, from those who were previously diagnosed with depression, anxiety, etc., how do we know that it's specifically PMHD and not their previous diagnosis of depression?
Okay. Um, well, I would say that it would probably, if I'm being honest, I probably wouldn't distinguish about like what we're calling it. It would probably just be depending on how much it's impacting you and your ability to care for yourself and your baby. So any of the mental health disorders, if you can have symptoms, like sometimes people will tell me, well, I get sad sometimes, and I'll say, well, that's because you're a human being. But if it's starting to impact your ability to care for baby, take care of yourself, you don't feel like yourself, your self-esteem is impacted, then we're looking at perinatal depression.
Okay. I I appreciate it. It's really kind of just six of one, half dozen of the other, and whatever we call it. But does that exactly what you were saying, that it doesn't matter whether it's co-
Yeah,
depression or
I don't think it
PMH?
really matters if we're calling it like normal depression or perinatal depression. It just depends on how much it's impacting you. I
Mhm.
don't necessarily care about the label of it. I just want to make sure that you're you're not in distress, or you're not feeling like it's preventing you from doing the things that you need to do.
Right. And if anybody feels like there's more to their question, please go ahead and reiterate it in the question and answer box. Thank you. The next question says, do you or other providers take public aid? I think you mentioned that at the end.
Yep. So I think as far as I know, I am the only like PMHC that does, but everyone within my practice in Willow Creek Counseling takes Medicaid, and I'm sure that there are other providers that will as well. But as far as a PMHC, I'm the only one as of now.
Right. And of course, that's for the Rockford area. We may have
Yes.
people from other areas. But you can also call our office and we can help you find a provider. Thank you very much for that one, Kate. The next one says, this is not a question, but I wanted to say how seen I felt by your presentation. I struggled with depression and OCD after my daughter was born, and I felt that I was crazy because I had those thoughts you were talking about. Thank you for bringing awareness and normality to this.
Thank you. That's great to hear.
All right, and now person asks, does mental health first aid training exist for this population, specifically for community health educators and community members?
Not that I'm aware of, but I often think about that. My brother-in-law is a firefighter and a paramedic, and I think about that often. How many calls he's responded to where it's a new mom, and he just doesn't know anything different. And so we talk about that a lot. But that's a great point and something that I think about a lot in terms of ER nurses, first responders, things like that. If it does exist, I'm not aware of it, but it should.
Well, as program coordinator, there's a program we have called Provider Education that I'd love to bring into our area, and they ask for a mental health professional to be on the panel with a family member and a person living with a mental health condition. So maybe we can talk. All right, next one. It says there is a similar program in Boone County, and I can't remember exactly which program they're referring to, but at the time you had this. I know that you had the resource panel up on the screen,
Oh, okay.
and we will have. I'm glad to know that there are resources in Boone County. We cover NAMI Northern Illinois, Winnebago, Boone, Stevenson, and Joe Davies counties.
Oh, that must have been about the Universal Newborn Support System. Whatever that is in Boone County, whoever sent that, if you could send me that information, that would be great. I would love to have that as well for people that are delivering outside of Winnebago.
Great. Thank you. And I will make sure we have your contact information in the slides that we send along. Sherry, the same person, says, thank you. Great information. Carolina, is there any way to get you referrals? Or to maybe that means refer people to you?
Yes. So I tell people my information is on this slide here, the 815-408-6825 number. You can text me. Sometimes that's much less intimidating for people too. Um, Anyone who wants to reach out, I will follow up with and let them know, what my availability looks like. You can also email me. I want there to be no barriers to reaching out. So if it's call, text, email, whatever, that is great.
Good, good. All right. Now, when do you know if it's an okay time to stop taking meds that you were put on specifically for postpartum depression?
Great question. One thing that I make people aware of is there can sometimes be a rebound of symptoms, I guess we could say, when a person stops breastfeeding. So if you're currently breastfeeding or pumping, that's something to be aware of. I usually like people to be like over that hurdle. But otherwise, that's a great thing to talk about with your therapist, with your doctor, whoever's prescribing. I usually like people to wait until after the first year. Now, there could be a lot of, layers to that too, but I usually like people to be out of the first year and have really processed through what contributed to their mental health issues and have them be able to identify for me, like, I have these coping skills now. I have these supports that I can go to. So it really kind of depends on a person's ability to do that. But as a general rule, I usually say until after the first year, after they're done breastfeeding.
All right. And the final question here. Um, Marissa says she's a doula who's returning back to work 7 months postpartum, uh, and went through PMHD. What suggestions do you have for moving forward after experiencing PMHD?
I have so many follow-up questions. Do you mean because you are going back to work as a doula and that may be triggering for you, or do you mean how to educate other people that you will be working with about PMHDs?
Yeah, she can type it in yeah, both. Yes, all of the above.
Um, I would suggest, if you think it would be helpful, that you kind of work through your own experience and talk about, what were the steps for helping you recover from that. Um, just to make sure that there's nothing that's triggering that's going to jump out at you once you get back into the workforce and start working with people again. And then I think just having open conversations with the people that you're working with about, these are the numbers. 20% of people may struggle with a PMHD. And, what is your mental health plan for after you deliver? How can we give you coping skills for, during labor and delivery? I would just normalize a lot of that and give people opportunities to say, oh, I'm struggling or I'm really worried about this, and then have the resources for Postpartum Support International or for your local providers to be able to say, like, okay, I think that you might benefit from talking to somebody about this.
Well, Kate, I really appreciate your time and those for all of the questions that we had. Let's see if I can get this back. Tremendous presentation. Thank you so much. Um, we do these regularly, and I'm learning as we go along, but um, this is a great community effort. I'm glad to see that we have such a person in our area, and I think people see your contact information there, and I will be following this up with a copy of the slides, and if people need CEUs, we'll have a 1 hour CEU credit. Thanks
Perfect.
again.
All right. Thank you.
All right, everyone. Have a good afternoon, everyone. We'll see you next time on Leading the Conversation from NAMI, Northern Illinois.
Thank you.
Bye-bye. There we go.